Right, so let's have a look at the next case. So I'm just going to download the images. And so what you do, you click on the download and then you got that red thing going right across the top. And when that's all the way to the top, that's when you know you're ready to have a full scroll through. But this one, you can still scroll through quite nicely, but you won't be able to go through all the images just yet, right? Right, so let's have a look. So contrast in our study? Yeah, contrast, I think so. What phase? So let's look at the portal vein. The portal vein is there. That looks slightly brighter. So therefore, someone said lots of fat. Whereabouts? Okay, so um, I mean, everyone's got a bit of fat, don't they? So then you got your portal vein that's there. You got aorta that looks like that. So this is brighter. This must be a portal venous phase image. And then what I'll do what I promised. I'll do a one scroll through. So let's go from the top all the way down, 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 like so. And look, that is okay. So now you've gone all the way down and all the way through. And I suspect the person that is messaged here is talking about this region over here. Yeah, and you'd be completely right. There is something not quite right about the area. We've got to try and figure out what is going on, right? What's actually happening with this patient. You may have noticed they've got a whole load of these sort of subcutaneous fat stranding there. And that's most likely, usually, yeah, exactly. Well done. Most likely because they're diabetic, they've had insulin injections, and that kind of thing. So now when you look up here, they've had some previous gastric surgery as well. Can you see that? It looks like they've had maybe sort of gastric band or some sort of surgery up in the abdomen, but that doesn't look like it's related to what's going on. So then we have to go back to basics and figure out what's happening here. So gallbladder looks okay, liver looks okay. What does the pancreas looks like? That usually gives you, if there's any problems you see around the pancreas, this is the peripancreatic fat. Pancreas looks okay, doesn't it? Adrenals look okay. Kidneys are here, nice looking fat there as well. That all looks good. Actually, I wanted to go back to the last case. After this, I'll go back to the last case. It was something I wanted to check. And then look at that spleen. Can you see that? That kind of area there doesn't look quite right. Spleen is there, and then a whole kind of segment of it looks like it's not enhancing for some reason. So let's go on the coronal images and see what it looks like there. So the coronal images, yeah, it looks like a wedge. Yeah, so exactly. Someone's kind of pretty much said it. So it looks like a wedge, right? And so when you got wedges, yeah, then it's most likely to be an infarction. There's been an infarction. If you get wedges in the kidney, it's an infarction. You get big wedges in the liver, it's probably going to be infarction. Same as the spleen, you got this kind of wedge looking area that looks like an infarction. Right. So we figured out this person's got an infarction of the spleen. So they've probably got some sort of the vascular path or something like that. But then you've got this area over here. It looks like there's a bit of fluid there and lots of fat stranding. So is there a perforation? Like, is that going to be what's going on? So you got to go for the bowel, go all the way up, follow it around. So that's sigmoid colon, going all the way across, all the way across, all the way across like this. Keep following, follow a mouse, follow a mouse. There we are, coming up, coming up, coming up, coming up. I haven't seen any perforation. It's all around this area, isn't it? It's coming up, coming up, coming up, coming up, coming up this way. Yep, that looks okay, doesn't it? Doesn't look like there's any perforation. The bowel actually looks all right. So then if there's a perforation, there'd be air, like that last case that we had. So let's go for the lung windows. Lung windows look okay. So I don't see any sort of free air anywhere. Definitely not in the upper abdomen. No Lockheed's there outside the bowel. So it doesn't look like we've got an infarction going on. So what are we looking at here? So we have got, so you've got your mesenteric. So this is your mesenteric side. And then you've got your anti-mesenteric side, right? This area over here. And this looks very sort of spherical, lots of fluid located within that region. And actually what this would be in keeping with would be, oh, hang on, have I got the wrong windows? This would more likely be in keeping with an mental infarction, a bit like when you get an epiploic appendicitis. Sometimes you get these post-surgery, sometimes some of the vascular path. There's been lots of reasons for someone to have a mental infarct, and this is most likely what this is. This area over here, you've got this sort of fat that looks like it's sort of becoming liquefied. There's lots of fat stranding around that area. And then on the background of also having a wedge infarct of the spleen suggests that they may be throwing off clots or there's something wrong with the vascularity with the vessels. They're also diabetic. So generally diabetics will also be more prone to sort of vascular problems like this. So this is most likely what it's going to be like, a mental infarct and a splenic infarction as well. A mental. So let me, OMENTAL. Oh, you know what? I haven't written that well. That's an E, yeah? A mental. I've written that terribly, but a mental infarct. Have a look. It's quite interesting, interesting little thing that can happen. But I've seen these, right? So we've had post-surgical patients, and they've got this collection, and they keep following up, and this collection is just not disappearing, and it's because yeah, it's kind of collection, but it's not a collection at the same time. It's not quite the same. There's not perforation like that. It's like infarcted fat as a result of someone going in and nipping a vessel or being a vascular path in general.